morning, everyone. September is Ovarian Cancer Awareness Month, and perhaps you've heard of ovarian cancer and perhaps you have not. The ovaries are next to the uterus and they make the hormones estrogen and progesterone, and they also make eggs that can get fertilized so that we can have babies. That's what the ovaries are. And they can get cancer, three main cancers that are very, very deadly and bad cancers. So it's good to see your gynecologist regularly, once a year, and have regular routine visits and discuss with them any of your concerns. It is true, though, that ovarian cancer comes pretty fast, it grows pretty fast, and it is also known that once symptoms appear that it's pretty far advanced. The symptoms are vague for ovarian cancer. They're stomach bloating, pelvic pain, fatigue, GI upset. So those are such, they're not specific symptoms. It's difficult to make the diagnosis. However, if you are having symptoms like that, especially anywhere from your 30s to your 80s, if you see your gynecologist, we will always get an ultrasound, and that will show us the ovaries to show if there's anything happening with the ovaries, any growths or tumors or cysts on your ovaries. So it's always good to come see your gynecologist. So you've probably heard that CA-125 is a blood screening test for ovarian cancer. Way back years ago when Gilda Radner from Saturday Night Live got ovarian cancer and unfortunately died from the disease, her husband at the time, Gene Wilder, was coming out in the media and saying everyone should be screened with a CA-125. But that is not feasible, because to do that you'd probably need a CA-125 monthly, because the ovarian cancer grows so fast. So you can't come just once a year and get a CA-125. It's not really helpful. But once you have the diagnosis of ovarian cancer, the CA-125 is useful to see if the chemotherapy is working and dropping the level of the CA-125. And we've made a lot of headway in the treatment of ovarian cancer, so that people would used to, back when Gilda got it, would get the diagnosis and have surgery to remove the tumors and then be on chemo, but unfortunately die in about 2 years. And now the chemo is so much better that women are living 5 to 7 years. It's still a very sad disease, and we're working hard to try and find some good screening tool that we could find women who are at increased risk of getting ovarian cancer or who have early disease. That being said, you've probably heard of the BRCA1 and 2 gene, and that's a genetic error on the DNA where women are at increased risk of getting ovarian cancer. And we do know that, and the recommendation from our American Congress of OB/GYN is for them, when they're done with childbearing, to actually have their ovaries out, because they do have a 70% chance of getting ovarian cancer. So we do that surgery, Dr. Grove and I, and can take care of you. And if you have any questions about ovarian cancer, please make an appointment to come see us, because we'd love to talk to you.